Good morning and welcome. It's a little rainy out there, but we're not going to have that dampen our spirits because we have something to celebrate today. My name is Barbara Wolf. I'm Dean and Professor at the URI College of Nursing, and welcome to the 2022 Fall Semester White Coat Ceremony. And we thank everybody for joining us. If I can just make a quick reminder, if everybody could please silence their cell phones so that we don't have any disruptions during the ceremony. We are all excited about being here today, and again, this is a very momentous occasion, so let us begin. The White Coat Ceremony is a tradition that symbolizes a pivotal moment in the career of the students before us. Joining me to mark this occasion are our faculty, Interim Associate Dean for Undergraduate Programs, Dr. Melissa Sutherland, today's guest speaker, URI College of Nursing alum and Vice President of Asset Management for Mass General Brigham, Dr. Elaine Bridge, and Clinical Associate Professor Joan Dugas, who will deliver the faculty welcome. Again, thank you very much for being here. Family, friends, and guests, it's great that you took the time out of your busy schedules to join us on this special occasion. I'd like to take a moment to reflect with the students what this pinnacle event means. For you, this is a rite of passage as a student into the nursing profession. It marks your entry into caring for the lives of others who will depend on your own skills and vast knowledge for their lives. For the faculty and myself, it's launching a new cohort of, quote, white coats. These are individuals who are joining us in the privilege of being an entrusted provider in nursing care for others, often during the most vulnerable times of their lives. Reminding us of this trust is the National Gallup poll that continues to rank nursing as the most trusted profession for 20 years running. Today, you'll hear about the traditions of the white coat, but before we get to that, let me start by saying congratulations to you on reaching this exciting milestone, and congratulations again to the family and friends who've supported you to get here. So congratulations. You've worked very hard. Chemistry is behind you. And now you have the foundational knowledge to begin advanced nursing courses and clinical rotations. You will experience the transition from practicing on mannequins to applying that knowledge to real people who need your care. In this transition, you are bound by the same professional commitments that bind all nurses. This includes the American Nurses Association Code of Ethics. This code is fundamental. It's a fundamental document to how we practice. It is a social contract with society, and it's your professional obligation to uphold this code now, today, and as you move forward in your career. The Code of Ethics for nurses is a promise that you are doing your best to provide care for patients and communities and are supporting each other in the process so that all nurses can fulfill their ethical and professional obligation. The historical roots of this code stem from the Nightingale Pledge that was introduced in the mid-1800s. The code was revised to reflect both social and other changes in medical health and advanced health care. This code is foundational and essential for nurses to practice with excellence and maintain the trust of the public. At this time, I'd like to remind you of these 9 provisions, and as I do, I ask that the candidates take a moment to reflect on them and think about your duty to uphold each and every one of them. Number 1, the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. 2, the nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. 3, the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. 4, The nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes actions consistent with obligation to promote health and provide optimal care. 5, the nurse owes the same duties to self as others, including the responsibilities to promote health and safety, preserve wholeness of your character and integrity, and maintain competence and continue personal and professional growth. 6, the nurse, through individual and collective efforts, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment conducive to safe, quality health care. 7, the nurse, in all roles and settings, advances the profession through research and scholarly inquiry, professional standards, development, and the generation of both nursing and health policy. 8, the nurse collaborates with other health professionals and the public to protect human rights, promote health diplomacy, and reduce health disparities. And the last one, number 9, the profession of nursing collectively, through its professional organizations, must articulate nursing values, maintain integrity of profession, and integrate principles of social justice into nursing and health policy. As you move forward in your career, be informed and inspired by this code to uphold nursing excellence. I would now like to introduce to you Associate Dean for Undergraduate Programs, Dr. Melissa Sutherland, who will bring greetings and provide a history on the pinning tradition. Dr. Sutherland.
Good morning and welcome. So wonderful to see you all today. The white coat ceremony is a milestone in your nursing education. The white coat represents the demarcation between your preclinical coursework and the phase of your education, clinical, where you will be now caring for patients. It demonstrates your growing knowledge and evolving expertise. It stands as a symbol that distinguishes you as a member of the patient care team, and as a member of that team, it represents the trust that patients will have in you. The first white coat ceremony was established in 1993 at Columbia University College of Physicians and Surgeons through the vision of Dr. Arnold P. Gold. He believed that medical students should be given well-defined guidelines regarding the expectations and responsibilities appropriate for the medical profession prior to the first day of education and training. He believed that a declaration of commitment to the tenets of the medical profession should be taken at the start of education and not at the end. Since that time, his vision has expanded to include various medical professionals, and in 2014, through the partnership of Arnold P. Gold Foundation and the American Association of Colleges of Nursing Support, was offered to establish white coat ceremonies for nurses. What started as a formal commitment to the profession has evolved to an overarching commitment to healthcare. As stated by Arnold P. Gold Foundation, healthcare professionals in training and in practice must embody a culture of respect, dignity, and compassion for patients and professionals. When skilled practitioners build caring, trusting, and collaborative relationships with patients and each other, the result is better care decisions and better healthcare outcomes. So marking this occasion of your readiness for clinical education should also carry a reflective moment of your commitment to the practice, values, and ethical standards we as nurses have to our patients, their families, and patient care teams. It is your public declaration that you will always be prepared through study and training to provide knowledgeable care and ready yourself to always uphold human dignity in all aspects of your practice. Congratulations and welcome.
Thank you, Dr. Sutherland, for providing the historical context of this very important event. I'd like to now introduce our attendees to the College of Nursing faculty. These individuals are joining you not only here today, but they are going to be with you throughout your journey of this education and then following it as well. They are the individuals who help you become the professional registered nurse that you will be. Faculty, will you please rise? These faculty members are an exceptionally talented group of scholars who are committed to the learning of each and every student. They are responsible for shaping the profession of nursing nationally and around the globe with their contributions to developing nursing theory, research, science, practice, and policy. So thank you for all that you do and all that you will do in the coming years. But in addition to these areas of expertise, they are formidable teachers, mentors, role models, who will take special interest in you as an individual and help you to develop into a successful professional. Please seek them out. Their wisdom is enormous, and they have much to offer you. Now it is my pleasure to introduce our guest speaker for today's ceremony, Vice President of Enterprise Asset Management for Mass General Brigham, known as MGB, and the University of Rhode Island College of Nursing alum, Dr. Elaine Bridge. In her role, Dr. Bridge has executive oversight and responsibility for developing and operationalizing MGB Enterprise Asset Management Program across the entire Mass General Brigham system in Boston, Massachusetts. She has also served as the Vice President of Strategic Operations for MGB Digital Health and provided oversight of the digital health enterprise efforts related to patient experience, user experience, and virtual telehealth care. She served as the VP of Clinical Operations on the Partners eCare, also known as EPIC, leadership team for Partners Healthcare. Additionally, she has served as Senior Vice President for Patient Care Services and Chief Nursing Officer at Newton Wellesley Hospital in Newton, Massachusetts. Dr. Bridge received her Bachelor's of Science in Nursing from URI, her MBA from Framingham State College, and her Executive Doctorate of Nursing Practice from the MGH Institute of Health Professions. She is a past member and past president of the Organization of Nurse Leaders of New England and a clinical instructor at the MGH Institute of Health Professions and an assistant professor at the Graduate School of Nursing at UMass Worcester, AKA she does not sleep. She is also a member of the Nursing Advisory Board at both the College of Nursing here at the University of Rhode Island and also the Graduate School of Nursing at UMass Worcester. Please welcome Dr. Bridge.
Well, good morning, everyone. It's so nice to see you all here on this beautiful never mind, it's not a sunshiny day. I am delighted to be here. So thank you very much, Dean Wolf, and good morning to all the faculty, all of you students, your family, and your friends. It's just a real privilege to be here and share a few thoughts with you this morning. The introduction, a little long, I would say. I just said to Dean Wolf, I'll have to shorten that for the next time. Does talk about some of the opportunities I've had in my career, and with great fortune, quite frankly. And we'll talk a little bit about that in a few minutes. I am very honored to speak here today. Barbara was asking me how my trip up here was. I live on Cape Cod. So I very smartly thought, I'll come the night before and stay with my sister here in Narragansett, and I'll be here fresh as a daisy this morning. So 4 hours in the car got me to Narragansett. through all sorts of detours because I had to stay out of Providence because there was the massive flooding in Providence. So I guess the lesson is be prepared and know that you won't be prepared for every eventuality. So maybe take that lesson as the first one. I am going to share a few thoughts based on my experiences in my career. I hope they resonate with you, and if they don't right now, maybe along the way they will. I've been in this business, as we say, for 40-plus years, and I can tell you this. In that time, I've had a lot of wonderful opportunities. I've had some very challenging opportunities. I have learned so much about myself along the way, so be prepared for that education. And a lot of stuff, you know, it dulls over time, but there are a few things that stay very clearly and crystally in my mind. I generally can't remember what I had for breakfast in the morning anymore, but I can tell you exactly what happened on my first day of clinical as a student nurse at the University of Rhode Island. I can remember going to a nursing home down the road, and it was Allen Nursing Home or something like that, and being so excited to go into my very first clinical experience with my freshly pressed uniform and a cap and a very tight waist, as I remember, but I got over that. And my white hose and my white shoes, and I was fresh as a daisy and ready to go. And really, really excited and feeling like I was finally at that place in my journey as a nurse where I could get to the patient. And then it hit me that I was at that place in my journey where I was going to get to be in front of a patient. And I will tell you, I approached that experience with a very healthy, if not terrifying, dose of trepidation. I mean, after all, how was I even going to walk into my patient's room and introduce myself? How do you do that? You don't learn that. You just have to figure it out, right? Well, actually, we probably did learn it, and I couldn't remember how to do it. And what in the world did my patients expect of me? And how could I possibly hide the fact that I felt like a total imposter? What was I doing in front of a patient, after all? And then I got surprised and reminded over and over again over the course of my career. The patients were incredibly generous of spirit and understanding and compassion. They are almost always, if not always, kind. They are gracious. They are grateful. And in this case, they certainly understood that I was a newbie, because I was introduced as such. They forgave my wobbly, nervous voice, and they made it easy for me to walk into that room and do what I had been taught to do. So they were generous of spirit, and they were kind. But wait a minute, wasn't that my job as the nurse to be the one that was generous of spirit and kind? But in fact, it goes both ways. And so I've got 3 points I want to bring to you today. I'm not sure I could get through more than that in the time allotted, and it's probably plenty of time for what you have tolerance to listen to. Number 1 is the golden rule. And you might roll your eyes and think, oh, not that again. Do unto others as you would have them do unto you. But I have to tell you, that approach, not only to nursing, not only to your patients, not only to your colleagues, but to yourself and to the people you love around you, it pays dividends, and quite frankly, as old as it is, it never goes out of style. So keep that in the forefront. Let that be maybe your North Star. My second point is about the person versus the patient. You're going to learn a lot. You've already learned a lot. You've gotten through chemistry, as Dean Wolff said, and that's not easy. I didn't enjoy chemistry at all, and I remember that part too. And so there's so much to remember. So many data points, so much technical information you've got to assimilate as you approach each patient in each situation. And it's really easy to forget that there's a person in that bed. A person first, a patient second, right? And so I urge you to be curious about the person in the bed or the person in the chair or wherever it is you're interacting with your patients. And I looked up the word curiosity because I was like, well, what does that exactly mean? Have I ever really looked that word up? And to my surprise, the first thing that came up as an adjective was nosy. And I don't think that's really what we're talking about here. But inquisitive was the second word, and I might flip them around. Because I'm not going to ask you or encourage you to be nosy, but I am going to ask you and encourage you to be inquisitive about the person in front of you. Who are they outside of the hospital? What goes on in their family life, in their home life? What are their interests? And frankly, it will allow you to develop a far more therapeutic relationship with your patients. It will allow your patients to relax and to talk about something besides how badly they feel in the moment. And it just pays dividends over time. Another thing that pays dividends. It's very easy to hyper-focus on the diagnosis, the differential diagnosis, the medications, remembering what each medication does, how often to give it, what to look for side effects, et cetera. There's a lot to remember. Those are the hard skills. The core clinical knowledge is essential, and you can't skip it because it just won't work. But if you skip the part about learning about the person in the bed and the family around them, if there is family around them, then you might be missing an opportunity to take an approach that is more holistic and far more therapeutic than just going through the rote motions of delivering clinical care. And delivering clinical care is a lot. So I don't mean to minimize that, but I do want you to think about how to integrate it all in. And again, there's a lot to remember. There's a lot of pressure. You might have an instructor looking over your shoulder because they want to make sure you do it all right. And so just try to relax a little bit because your patients will relax, and if everybody's relaxed, things go a little bit better. And all of that hard stuff that you have to learn, all of the clinical information, the core knowledge, the details, the critical thinking, the tasks, that all will come in time. Not the day one, probably, unless you've been doing a lot of work off to the side, but it will come. And so integrating that into learning about the person who is your patient will help you a lot. So that's point one. Point two, excuse me. And point three, if you carry that forward and think about you as a person first, and then as a nurse second, it will also help you think about things in a little bit different way and consider what kind of nurse you want to be, not whether you want to be an oncology nurse or a home care nurse, but what kind of nurse do you want to be? How do you want to approach your patients? How do you want to work with your colleagues? How do you want to advance the discipline of nursing? All of those things are part of the deal here. And so I would say this, there's some very good news out there for you. In my 40-plus years, I've learned that there's a lot of pathways to deliver nursing. And a lot of people are interested in what you have to say as a nurse, far more today than they did maybe when I was first starting out. So that's the good news. And you can be at the bedside, and there will never be enough nurses at the bedside, so please don't think that that's just the first step. It might be the only step, and I, for one, will be grateful if you stay there. And you can also go all the way to the boardroom. And I've seen nursing colleagues and friends do all of that. You can be an entrepreneur, you can be a leader, you can be in business, you can set policy. The world is your oyster as a nurse. It's a career and a training and an education that just opens up any door you can possibly imagine. If you listen to anything that Dean Wolff was saying about my career, I couldn't have imagined doing what I've done. I could not have imagined that I would be leading an enterprise activity at a very, very large 84,000 plus person employee organization, delivering care to thousands upon thousands of patients every day. And I'm leading a project that will allow the entire institute, the entire system, to understand how they're using their assets now and how they will leverage those assets to in service to patients. Never could have imagined that. Couldn't have imagined spending time away from the bedside, quite frankly, at first. Went into management, thought I was much smarter than all the other managers, so I could do it better. That's actually not true, but I certainly went into it with that kind of a bit of an attitude. I spent a little time in Malta, which is a small country south of Italy, attempting to do something there with their healthcare system. You couldn't have convinced me of any of that when I was sitting in your seat. So I want to ask you to think about being curious about your career path. Not too early to think about how you as a person is going to inform you as a nurse. Think about where you want to go, what are the opportunities, how risk tolerant are you? Be open-minded, bet on yourself. I had a very wise chairman of a hospital board say that to me once, and I had to really ponder what he meant. Bet on yourself. Like, what does that mean? And what he was really saying is, you know, you've got skills, you've got capability. Go see what you can do with it. Don't hold yourself back. Don't be demure. Don't think, oh, I couldn't possibly. Be a little bold. Bet on yourself. Assume that you can do much more than what you think you can do, because usually we can. So those are the 3 lessons I wanted to share with you today. I do want to also say that you are in an excellent program for nursing. And I can say that having stayed involved in the program here at the College of Nursing for many years, watching it grow, watching it evolve, watching the caliber of student only get better over time. I probably couldn't have gotten into the College of Nursing if I were applying today, let's be honest. So I'm glad I was there then. And this program it set my foundation for the entire career that I've built. And it's why I've come back and spent time here and given whatever I have to give to this College of Nursing, to the university, because I really believe in paying it back. And so in closing, I will say this. I am very appreciative to be here. I am very grateful that you invited me. I hope that one little word that I've said will inspire you. And I thank you so much for coming into the profession of nursing. We need every one of you and more of you. And so, you know, go get whatever you can get out of this education. Go be with your patients, be a person with your patients, treat your patients as a person. And we're going to be in really, really good hands. So thank you very much.
Thank you, Dr. Bridge, for those valuable words of wisdom. It is now my pleasure to introduce to you Clinical Associate Professor Joan Dugas, who will deliver the faculty welcome. Professor Dugas is one of the first nursing faculty members that you will have this next semester. She, along with Dr. Marie Berry, who will be assisting with the white coat ceremony, will be teaching NUR 203, which is Comprehensive Health Assessment. Professor Dugas is a remarkable teacher and scholar, currently completing her doctoral studies in nursing. She is a published author with articles in the Journal of Nursing Education Perspectives, Applied Nursing Research, and The Nurse Educator. She has a wide range of clinical experience, including acute care, pediatrics, community health, and gerontological nursing. Please welcome Professor Dugas.
Well, good morning, everybody. First of all, I want to thank everybody, and I'm humbled to be the faculty representative to induct you into the College of Nursing. So today's a great day. It's a great day. And one of the things that I want to speak, especially to our incoming class and the people that you have invited here today, your family and your friends that you have invited here, because they are pretty essential for your success that you've had, and success moving forward. So in front of you, you have the pamphlet, the brochure for today's white coat ceremony. The first thing I want you to do is I want you to put that in a safe place. I want you to keep that. And I want you to think about this day, because 40 years plus from now, you'll be finding some old box in the closet, and out will come something that, a picture of you. I found a picture a couple months ago of my pinning ceremony, what I wore, and it brought back unbelievable memories. So I want you to keep that, and maybe even on the back write a little note about how you felt today. How it's a great day, and I just cannot overemphasize that enough. And think back even when this was move-in day last weekend, I think, right? So think about when you were a freshman, right? And look how far you've come in 1 year. So I just want you to take the time to reflect on your accomplishments and what you did to get here. All right, so I want to talk about success. So I have been an educator for many years in the College of Nursing now. And I want to speak specifically to you about the tips that I can give you to be successful in the program. And also, this is for all of your friends and family, so that when they need support, you can help guide them. You can help guide them to be successful in the program. You already know it's going to be challenging. You already know that, right? You know when you tell people that you're going to be in nursing school, they go, oh, that's fantastic. And then the next thing they probably say is, oh, it's really hard, right? It's really hard, right? So how do you get ready? So today, right, maybe a little anxious, right, about what's going to be expected, what do I have to do, like how do I get prepared to take care of patients? So my focus as an educator is to prepare you to take safe, competent care of your patients. And you start that next semester, which is one of the great things about our college. Next semester, you literally will be taking care of patients. So my job this semester is to help you be prepared. All right, so here's some tips. Number one, you got to put the work in. You got to it has to be a priority. Your studies have to be a priority. And it's hard, right? I'm still finishing up my doctorate, and I have a life outside. I have work full time. And there are days when, yeah, I'm kind of not feeling it, right? But you have to get a new perspective and go at it again. But you have got to give it the time, because it's new, right? And education is meant to challenge you. Okay, it's meant to help you think in a different way. All right, so that's number one. You got to give it the time. All right, number two, when you take your first exam, your first quiz, and it's not quite the grade that you want, you need to come see me. You need to come see me, okay? Because in my experience, you may think, oh, I didn't study enough, right? Or lots of reasons. But then you take the second one, and it's still not where you want it to be. Then your anxiety goes up, right? Then you're like, okay, game on. So what I'm asking you to do is, whoever your nursing professor is this semester, and this is for everybody out there that's helping you, remind your individual to go see your professor. We are so available. We have the best faculty in the whole world, and I'm not just saying that. We have the best student-focused faculty. But you need to make an appointment with us. That's adult learners. So make an appointment, email, right? We'll set up a time. You come to my office. I'm right in Whitehall, and we'll talk about some strategies. It's a different way of thinking when you take nursing exams. It's different. We test you to prepare you for practice. Okay? So come see me. Number two, utilize the resources we have for you. Number one, the resources we have tutors. I have a tutor designated for my class that conducts tutoring sessions 3 times a week. 3 times a week. It's through Zoom. You come in, you go out, you give it whatever you can. And go more than once a week, because the more you hear the content, then you'll be able to apply it. Okay, so please take advantage of the tutors that we have for our courses, and that's the first thing I asked you when you're having some trouble. Are you going for tutoring? Even if you go for an hour, 3 times a week, whatever you can do. Okay, number 3, the university has Academic Enhancement Center. The Academic Enhancement Center is specifically devoted for your success. Dr. David Hayes works in that department, has worked with nursing faculty and students for many years. You can make a direct appointment with him, and he will go over with you strategies on test taking, specifically nursing exams. Okay, Dr. David Hayes, okay? And the last thing to help you be successful, so let's go over. Number 1, give it the time. Number 2, come see me. Number 3, go for tutoring. Number 4, go to the Academic Enhancement Center. And number 4, you need to carve out time for yourself. You need to put it in your schedule, and it's a block of time that nobody gets. Go to the gym, go for a walk, call a friend, because self-care especially now, and I know you've heard a lot about COVID-19 and the effect of COVID on nurses, right? You know that. It's not for the faint of heart, nursing. It's a wonderful career. But you need to take care of yourself because you need the energy to study. You need the energy, right, for your exams. So whatever you do to fill your bucket up again, you really need to do that. Okay? So that was for all of you to be successful this semester, and for all of you here in this room, that you can help them be successful. So I just wish you the very best, and I will see you tomorrow in class.
Thank you, Professor Dugas, for your welcoming comments. To our candidates, I hope you have heard that everyone here is invested in your success and wants to support your success, whether it be faculty, staff, family members, friends, because we all know that we will need a nurse one day, and we want it to be a URI nurse. So please take that to heart. We will now begin the presentation of our coats ritual. Professor Dugas and Berry, can you please assist in the awarding of the coats? And Dr. Sutherland will call the students who will receive their official white coat from Professors Dugas and Berry.
Holly Adams. Juliana Aguiar. Kira Allen. Marisha Anand. Jamie Andrews. Delaney Augsburg. Julia Aravainen. Samantha Bacon. Hannah Benavides. Madeline Benson. Dana Bernier. Catherine Bianchi. Kaylee Bingham. Caroline Bishop. Emma Blake. Cameron Bouvier. Emily Brennan. Georgia Bright. Jenna Bryant. Jacqueline Kanjalowski. Carly Caperin. Sean Cheney. Eva Church. Alexandra Simbal. Corinne Connolly. Grace Conway. Tara Conzone. Abigail Cornelia. Darcia Costa. Olivia Cote. Cody Cregan. Amanda Dower. Haley Davis. Joseph Damasi. William DeRain. Juliette Descharnay. Madison De Sousa. Grace Dietrich. Jules Diax. Sophia DiMartino. Annabelle Diomede. Elisa Dolman. Elizabeth Durkee. Ashley Farinella. Samantha Finder. Isabella Fontana. Olivia Gardikis. Abigail Gigliotti. Kelsey Gill. Ryan Gorley. Jennifer Hall. Abigail Hansberry. Alexia Hay. Isabella Hine. Michaela Height. Jillian Hobbs. Ava Infantino. Ashley Jablonski. Lainey Johnson. Amanda Kernan. Molly Carrigan. Katie Kerwin. Avery Korzanowski. Reese Lally. Emma Lee. Abigail Lefkowitz. Emily Lavek. Elizabeth Lewis. Jessica Libonate. Leah Lingen. Michaela Longo. Madison Lorello. Paige Lubansky. Victoria Lewis. Rebecca Lineman. Sabrina Magiacomo. Jessica Malata. Mackenzie Monero. Sarah Marchak. Madison Martins. Davis Matos. Taylor Mazzunchelli. Quinn McCarthy. Lindsay McCullough. Kayla McGrady. Grace McGuire. Megan McKenna. Tracy Meekins. Brooke Minty. Christina Mesita. Zoe Moss. Sean Murphy. Kaylee Nagel. Hadley Nussbaum. Linnell Ortiz. Jack Paget. Abigail Pagnozzi. Gianna Penny. Paige Perkins. Jessica Pettit. Grace Foff. Kara Piałkowski. Samantha Pinero. Sophia Paramuka. Amanda K. Dawes. Samantha Rahab. Kaylee Rakowski. Aria Rayo. Paige Rice. Megan Roeder. Sophia Roman. Alexandra Salvatore. Lexi Samuelson. Courtney Saris. Olivia Sherman. Erica Scott. Morgan Selgrade. Eva Cernersha. Katie Seppa. Francesca Sessa. Emily Smith. Paige Spooner. Gabriel Stafford. Emma Stebane. Kaylee Steinkamp. Devin Stetson. Okay, great. Madison Sullivan. Carly Taus. Kara Thim. Helene Zumakaris. Isabella Vaca. Ashley Valentino. Olivia Vendez. Emily Venezia. Jacqueline Viveras. Clara Von Wagner. Annie Webb. Eliza Worrell. Crystal Yates. Sharon Udace. Julia Zaccardelli. Desiree Zuhari. And Maura Zeddingren. Please join me in congratulating our new white coats.
All right, now for the oath. So will our students who are being coded today please rise and raise your right hand and follow the instructions. Repeat after me, okay? Here we go. As a nurse dedicated to providing the highest quality care and services, I solemnly pledge that I will consider the welfare of humanity and relief of suffering my primary concerns. Act in a compassionate and trustworthy manner in all aspects of my care. Apply my knowledge, experience, and skills to the best of my abilities to assure optimal outcomes for my patients. Exercise sound professional judgment while abiding by legal and ethical requirements. Accept the lifelong obligation to improve my professional knowledge and competency. Promote, advocate for, and strive to protect the health, safety, and rights of the patient. With this pledge, I accept the duties and responsibilities that embody the nursing profession. I take this oath voluntarily with the full realization of the responsibility with which I am entrusted by the public. Will the audience please join me in welcoming this esteemed group into the next phase of their career? Congratulations, and you may be seated. Thank you. So in closing, I would like to thank you, family members, friends, and Dr. Bridge for taking the time out of your busy schedule as well in terms of joining us and celebrating in this very important event. Thank you to the faculty for helping to launch this next group of cohorts and all the work that you're going to be doing with them in the next several years. And a special thanks to Assistant Dean Jess Beauclair and the academic advisor, William Poole, for organizing this important event here today, and the staff who have helped, again, with this special day, including our student ambassadors who are here. Finally, congratulations to students, Welcome to a fabulous and rewarding career in nursing. I look forward to seeing what you do with it. And this concludes our celebration. Thank you for joining us, and congratulations.